Have you ever taken a pill for heartburn or, an upset stomach and just wondered what is actually going on in there? Well, today we're going to pull back the curtain on gastrointestinal drugs. And I promise, by the end of this, you'll see that relief you feel in a whole new light.
I mean, it's kind of magic, right? We know these things work, but how? How does one little pill know how to fix something as complicated as our entire digestive system? Let's break it all down. Okay, so here's the secret. The best way to get a handle on all this is to use a simple but really powerful analogy. I want you to picture your digestive system as this massive, complex factory. Every single drug we're about to talk about, it's just a specialized tool designed to fix one specific machine on the factory floor.
So, our first stop on the factory tour is the stomach. And for our purposes, let's just call it the boiling pot. Its whole job is to use super strong acid to break stuff down. But, as you can probably guess, sometimes that boiling pot causes some pretty serious trouble.
You know that feeling of heartburn? That's what happens when the acid from the boiling pot starts splashing up where it shouldn't be. That's GERD, or acid reflux. And if that acid starts eating away at the stomach lining itself, well, that's how you get a peptic ulcer. The bottom line is, the boiling pot is out of control and it's damaging the factory itself. So how do we get this thing under control? Well, we've got three main strategies. First, we can turn down the heat using things like PPIs and H2 blockers, which actually stop so much acid from being made in the first place. Or we can add cold water with antacids to instantly neutralize the acid that's already in there. And finally, we can put on a lid with drugs like sucralfate, which basically creates a protective layer over everything. And this, right here, is probably the most important difference to understand. PPIs and H2 blockers, they're proactive. They go to the source and reduce acid production. Antacids, on the other hand, are reactive. They just give you that immediate relief by tackling the acid that's already causing problems. So it's really a case of prevention versus a quick fix. All right, let's leave the boiling pot behind and head to the next part of our factory, the intestines. I want you to picture a really, really long conveyor belt. Its job is to move all the waste along, and while it does that, it absorbs water and nutrients. And the speed of this belt, it is absolutely critical. So what's happening when you have diarrhea? Simple. That conveyor belt is just going way too fast. It's in complete overdrive. Because it's moving so quickly, your body just doesn't have enough time to pull out the fluids it needs from the waste. And the result is, well, you already know the result. The fix for this is actually pretty straightforward. We just need to find the slowdown button for that conveyor belt. And that's exactly what drugs like loperamide, which you've definitely heard of as Imodium, do. They basically tell the intestinal muscles to just chill out, slowing that conveyor belt right back down to normal speed. But, of course, what about the exact opposite problem? Constipation. This is when our factory's conveyor belt just grinds to a halt. The whole production line gets backed up, traffic isn't moving, and everything gets, well, really uncomfortable. So, how in the world do we get the belt moving again? We have three main plays in our playbook here. We can push it with irritants like castor oil that kind of kickstart the movement. We can flood it using osmotics like lactulose, which pull more water into the area to soften everything up. Or we can grease it with softeners like docusane that make it easier for everything to slide on through. Push it, flood it, or grease it. Three different ways to clear that jam. Okay, for our final stop, we're heading way up to the factory's main control room, the brain. And we're going to look at the system that controls the factory's big red emergency eject button. Yep, we're talking about vomiting. You know, as awful as it feels, vomiting, or emesis if you want to get technical, is actually your body's defense mechanism. When your brain detects something harmful, whether it's bad food or even just signals from motion sickness, it smashes that eject button to get everything out fast. And that command comes from a very specific spot called the chemoreceptor trigger zone, or CTZ for short. So here's the wild part. If you want to stop nausea and vomiting, you don't treat the stomach at all. You have to go straight to the source. The real fix is to block those eject signals right there in the brain's control room before the command even gets sent out. And we do this with drugs that are basically just signal blockers. For example, some anti-nausea meds work by blocking dopamine receptors. Others, like dimenhydrinate, which you've probably seen sold as Dramamine for motion sickness, work by blocking histamine receptors. They intercept the message in the brain, and, just like that, the eject button is disabled. So now that we've done the full factory tour, let's put together a quick and easy cheat sheet.
These are a couple of really simple rules and connections that'll help you remember all this stuff out in the real world. Here is a fantastic little memory hack for you. When you're looking at stomach acid reducers, just look at the end of the name. If it ends in titidine, it's probably an H2 blocker. And if it ends in prazole, it's almost always a proton pump inhibitor, or a PPI. It's a super simple way to know what the drug does just by looking at its name.
And let's connect some of these scientific-sounding generic names to the brand names you actually see on the shelf. Loperamide? That's the active ingredient in Imodium. Omeprazole? That's the stuff in Ryzek. And dimenhydrinate is what you're getting when you buy Gravinate. Knowing both names helps you understand exactly what you're taking.
So there you have it, the boiling pot, the conveyor belt, and the emergency eject button. The next time you see one of those commercials for a stomach medicine, you're not just going to see the happy actors on screen. You're going to see the whole factory at work. And you'll know exactly which machine that little pill's designed to fix.